Today we're going to talk about physician integrated group practices, otherwise called supergroups. Why do physicians form supergroups? And there are a variety of reasons. Physicians, who are the only individuals in the healthcare spectrum that know how to treat patients, the full panoply of care, those individuals, physicians, have been left out of the discussion in many cases in terms of the business and even now the practice of medicine. Another reason is to enhance negotiating leverage with payers. And I'm not talking about just simply bullying payers into paying higher fee for service. I'm also talking about engaging in value-based negotiations with payers. Negotiating episodes of care, negotiating bundled payments, taking on risk eventually. These things cannot really be effectively done with small practices. The way that we have typically formed and seen these supergroups formed is through what we call an integrated group practice model consisting of various care centers. And what that basically means is that each practice that joins the supergroup, the old entities, the legacy entities we call them, stop practicing medicine as of the go-live date, and they begin to practice and operate under the new tax ID number. But each practice comprises a separate care center, which is like a division within the new entity. Let's talk briefly about the nuts and bolts of a supergroup. Just some random things that are, I think, frequently asked questions. What happens to my employees when I join a supergroup? What happens to my old practice, the legacy entity? If you're a physician that is a participant in a small medical practice in a competitive environment, you need to at least consider the possibility of forming and being part of a large group practice, otherwise known as a supergroup.